Good afternoon, everyone. A little hesitant to call this meeting to order too quick, as a lot of my colleagues have not joined us as of yet. Ms. Mathis, have you heard from any of the committee members?
I believe Ms. Newton has just joined us. Other than that, no, ma'am, I have not heard from any of the other committee members. Mr. Livingston has just joined us.
Okay. With that being said, we will call the Coronavirus Ad Hoc Committee meeting to order now. And if you will, please, Ms. Mathis, call the roll.
Certainly. McBride? Livingston?
Here.
Joe Walker? Barron?
Here.
Newton?
Present.
We have a quorum.
Welcome, everyone. Y'all were starting to give me a little scare here. So thank you so much for joining. We will continue with the business at hand, and that is the first order of business is to approval of our last minutes from our last meeting on April the 28th.
So moved, Madam Chair.
Second.
It's been moved and properly second. Is there any discussion or corrections that we need to put into the clerk's office? Given none, Ms. Mathis, if you will call for the vote at this time.
Certainly. McBride? Livingston?
Yes.
Joe Walker? Barron?
Yes.
Newton?
Yes.
Motion passes.
Our next order of business is the adoption of the agenda. Mr. Brown, do you have any corrections or anything that we need to add or delete?
The only thing that I would ask Committee Chair Barron is that item number 4D, we're going to have some guests on the line. Dr. Traxler could not make it, but we're going to have the Deputy Incident Commander. And if we could make 4D, if we could start with that item, specifically the vaccine portion of it for the update, I think that would be helpful for those folks who are going to give us an update from the community vaccination site.
Certainly. I actually had made a note that if we could just separate that all the way out, if we could just separate that as a separate item, I think somehow or another they got looped together.
Yeah, I saw that. Yes, ma'am.
So that if we're going to make it, and if I think what we'll do is, because we do have a guest, we'll do the vaccine first. So that will be item A, and everything else will follow suit in that order.
Madam Chair, I move to adopt the agenda as amendment by moving the vaccine site update to the first item for action, under the first item for action.
Thank you. Is there a second, please? Thank you. Ms. Mathis, if you will call the roll.
McBride? Livingston?
Yes.
Joe Walker? Barron?
Yes.
Newton?
Yes.
Motion passes.
And so our next item will be items for action, and we will start with our vaccine site update. Mr. Brown.
Thank you again, Ms. Barron. I appreciate the opportunity. We did have a request in to Dr. Traxler. She gave us an update at our last COVID meeting. However, she had a conflict in the meeting, but she said that she certainly will continue to support this initiative by having on our call this evening the Deputy Incident Commander, Mr. Stewart, who is on the Zoom call with us this afternoon. So, Mr. Stewart, if you could provide us with an update on the vaccination site and kind of those two questions that we talked about, give us an idea of the flow of traffic to that site, sir. And then there's gonna be a follow-up question concerning the number of residents in Richland County who have received service at that site. And if you can hear me, Mr. Stewart, I think you're able to go ahead and speak now, sir.
Okay, and I appreciate you getting us on early so we could get off early. Just a little bit of, I am Randy Stewart. I'm the Deputy Commander for the COVID response. We have been out at the CDC site here at the Columbia Place Mall for approximately, I guess, 5.5 weeks. It's scheduled to run for 8 weeks. We have been using the Pfizer vaccine for the first 6 weeks. As of Thursday this week, we will switch over to the Janssen vaccine or the Johnson & Johnson vaccine. And that will be for that 2 weeks, that will be the only vaccine that we'll have at the site. Flow of traffic and the way the operation has been working has been very, very good. I don't know if any of you have been out here, but it's very easy to get to the site if you come off a Park Lane and take a ride into the mall entrance, and you basically go right to go through the drive-through service and left to go through the walk-in service, and it's been working very well. Dr. Simmer came out last week, kind of walked around and talked to some staff and looked at the operation, and he was very pleased at the way it's been going. When it started, I think the numbers were a little bit lower than a lot of the participants here expected, but it's actually picked up since we've been here. And so as we say that, as of yesterday, close of business, the operation goes from 7 a.m. to 7 p.m. We had 17,675 people vaccinated. I got a number today from some of our staff. So, and the initial dose on that is 12,368. And the second doses we given is 5,458. Do you want me to go ahead and provide that number of Richland County residents now, or did you say somebody was going to ask that? Or
I know that the committee, Ms. Barron, was very interested in that information. So
okay,
go ahead and provide that to the group, please.
Okay. So far, the number of Richland County residents vaccinated here is 14,772. And I'll be glad to answer any questions you may have, or I actually have some staff here who have been at the site. They're here every day in the heat and the cold, working pretty hard. So I may have to use them to answer any questions you may have.
Okay.
Ms. Newton, you're recognized.
Thank you, Ms. Barron. And first, let me just say thank you for the wonderful job that you've been doing and the 14,772 Richland County residents that were vaccinated. I gave birth to one of those people that you gave the vaccine to. My 14-year-old went out there and he really had a great experience. So thank you for making it easy, and just, I feel so much better now that he is marinating, as we say over here. My question was just to confirm, my understanding is that while you're switching to the Janssen vaccine on Thursday, that if someone had their first dose with you and they set up an appointment for their second dose, that they are still able to go and complete their cycle there.
And what we're going to do, I believe, and Jamie, correct me if I'm wrong, that 2 weeks that we're having Janssen, they will not come get the second dose, but we're going to be here for 2 weeks after the Janssen. So it's going to be a smaller operation. You're not going to see all the big tents and everything, the FEMA van and everything out here. So, but for that 2 weeks, I think we're going to do 4 days.
We're doing 8 days total.
8 days total. There's 4 days the first week, 4 days the second week after we finish the Janssen, and you can come out and get your second vaccine then.
Perfect. Again, thank you for this great news, the work that you're doing out there.
Okay.
Absolutely.
Actually, I have one quick question.
Yes, sir.
what are y'all doing to continue to try to promote the site? And is there anything that Richland County can do to help?
We're doing a lot with our public information office. As you notice, if you come out here, we've got the big road signs up. I think that's been a lot, has helped the traffic a lot. You know, people recognize it. We also have it on the interstates coming into Columbia.
Yeah, I saw that.
We think that's been a lot. We haven't. I don't know that we've had a lot of inundation of the surrounding neighborhoods and going, you know, in those neighborhoods and asking people to do it. But I think coming by here and seeing it and all the advertisement we've had on the news. I mean, every night I see WIS, there's an update. Seems like every night at the beginning. Been a lot of radio ads, been a lot of interviews out here. So I think we've done a pretty good job of advertising it. But I tell you what, I'll go back and check with our PIO, and if they feel like Richland County can help us out anymore, we'll be glad to have any help we can get.
All right, thank you.
Ms. Newton, you're recognized.
Thank you, Ms. Barron. Sorry, one more quick question. I know you said, you know, in the number of weeks that you're going to end, but could you tell me the specific day that the vaccinations will end at that site?
So the Johnson & Johnson vaccine will end, is that June 9th?
June 9th is the last.
So the last day for the 8 weeks is June 9th. And then as we go and do those second doses of Pfizer for those next 2 weeks, that will be, so the 19th.
Well, then the following week, so the last day was
26th of June. So the very last day will be June 26th.
Perfect. Thank you very much. Thank you, Ms. Barron.
Okay.
Thank you. Thank you, Mr. Stewart. And Ms. Mackey, if you will allow me, and then I'll recognize you. But I do think that, you know, whatever we can do to assist to further get the message out is going to be critically important. Where I'm excited about the 14,772. That rings just sounds real good to my ears. But we're so far away from our target goal. So if there is something that we can do to support that, I know our PIO is definitely pushing lots of information out about the vaccine and as well as about the site. But, you know, any other measures that you see fit, we would love to be able to assist with that.
Yeah.
Ms. Mackey.
Thank you so much. I joined a few minutes late, so I hope I didn't miss this, but you mentioned that the site will end June 26th. I thought that I read somewhere that DHEC would be taking over the site. Can you speak to that at all? Or I'm sorry, Mr. Brown, if anyone knows if that's for sure. And if so, does that immediately happen the next day, right after June 26th, or is there a gap in time?
That's the last day we will be here. So the actual FEMA site with FEMA support, National Guard support, and I may have to get somebody to help me out here. That the June 9th is the last official day of the FEMA supported site. And that'll be that's June 9th. And then what we're going to do is for 4 days, the 2 following weeks, so it'll be a total of 8 days for the following weeks. We're going to be here, just a smaller clinic for people who got their first dose of Pfizer to come in and get a second dose of Pfizer. So it'll be a smaller operation. And I think that's what you mean. That's where when you're saying DHEC will be taking over site. The actual demobilization process with FEMA, National Guard, and all the other partners is actually starting earlier than that. What's that date, Jamie?
The 9th will be the last day. June 9th will be the last day of the actual site. FEMA will be leaving at that point. The National Guard, EMD, and the vendor will start demobbing the equipment that's going to leave the site. But when we do return to do the DHEC run site on June 15th, we will also have some National Guard support with us then as well. Richland County EMS has also said they're going to be supporting us, as long with y'all supporting us by letting us still use this facility. And so it's just going to be a smaller footprint and by appointment only. because we have appointments set up for all those folks that have been getting their first doses over the past couple weeks, so they can come back and get their second doses.
Ms. Mackey, does that answer your question?
Yes, and so just so I'm clear, come June 26th, everybody's gone, FEMA and DHEC, correct?
Yeah,
Correct.
Thank
Correct.
you.
Correct.
Are there any additional questions for my colleagues? Mr. Brown?
Yes, ma'am. Quick question to you, Mr. Stewart, and your team. In terms of the second dose shots, do you have to have your first shot at the site in order to get registered there for your second shot, or that be open for appointment to anyone who's already received their first shot?
I'm gonna let our site manager, Helen Campbell, answer that question. I think I know the answer, but I think she will be more accurate.
So folks who came through us for the first dose are given an appointment for that second dose period. If they have somebody in the car with them and they're needing their second dose, we won't turn them away because that is another opportunity to vaccinate somebody. But ideally, and what we're planning on are the number of folks that have been given an appointment.
Okay. Thank you.
Any further questions for Mr. Stewart and his team? If not, Mr. Stewart, thank you so much for joining us and giving us this update. And also congratulations to the team, because I heard on the news over the weekend that the site here in Columbia is producing more than anywhere else across the country. So congratulations to you.
Correct. We've been hearing that as well. We hope when we start the Janssen that we'll get even more people out here. So we're looking forward to it.
Thank you so much. And we will move forward to the next item on our agenda will be the COVID memorial. You can find that in your packet on pages 14 and 15. Mr. Brown, if you'd like to brief us on what the staff has recommended.
Yes, ma'am, Ms. Barron. And if I could just briefly let Mr. Stewart know that he and his team are free to go now after all the questions have been answered. So, Mr. Stewart, you're able to go now, sir, if you need to leave the call.
Thank you, sir.
You're able to go. Okay.
Thank you.
Yes, ma'am. So in your packet, what you have is a draft of a potential plan that you all could utilize and we could put together concerning a COVID-19 memorial service. Starting on page 14, you have the outline of what the program will look like. Specifically, we would plan for it to be an outdoor activity in the front of 2020 Hampton with a scheduled date of Thursday, July 15th, with an evening start time. We ideally will have some tents out there. So regardless of whether it's cool or warm, or maybe even, don't want to speak negatively, but misty, we'll have some tents out there to cover. The idea you see here that we would have a group out there or some type of musical selection happening during the time that attendees are gathering for the event, followed by opening remarks, which we believe would be appropriate either for the chair of the committee or council, whatever you all choose. We believe would be appropriate then to have an invocation from one of our local faith leaders, followed by some initial council remarks from council members. That's depending on how you all decide to set that up. That's certainly an opportunity there. Reading of a resolution, again, identifying the importance of the event that we're doing, followed by some community remarks. And the thought behind that was to invite all of our local municipalities and within Richland County who may have leaders who want to participate in this memorial service, and then also potentially give them just a couple moments to share their thoughts on this particular event. That will be potentially followed by a resident who unfortunately has had a member who passed from COVID, but to add some context again to our memorial service, followed by a member, Richland County, who's had a been a survivor of COVID-19. So again, we have individuals who unfortunately have lost loved ones, and we have also had individuals who have successfully survived severe bouts with COVID, and we thought it might be appropriate to have both of those different groups recognized in this event. And then followed by that, we thought we could certainly have a member of council then read a plaque that the county would put in place here at 2020 Hampton to commemorate and memorialize in a written format where individuals could visit the county when they come to the county and see that the county was very serious in its recognition of COVID-19 and its impact on the community. Followed by that, we would actually have the wreath laying ceremony. The idea there is we would have a wreath that is made. The wreath would be wholly full with a few opportunities for some additional flowers to be placed. The idea is a part of the wreath ceremony, while you would have the musical selection going, you would have members of council. We would have at least 11 represented, flowers that you would place representing the districts that are represented by Richland County and representing all of the families in those communities who've been affected by COVID-19. So the members would place those flowers in the wreath. Certainly a member of council could have a representation for them there instead of them doing it themselves. That's certainly up to the council member. But ideally, you would be representing all of the members in your district. And then right after that, the flowers.
Mr. Brown, I'm glad you clarified that. I saw members of council's musical selection. I thought we were going to have to do the musical selection, so I'm glad.
Yes, sir. Mr. Pugh and Miss Mackey told me that they wanted to lead that off. We're going to hang out as well. So, but no, hopefully you all will take that in jest. But no, Mr. Lincoln, the idea would be that members of council could themselves place the flowers within the wreath, or if they wanted to have someone or someone's representing their districts do that, then they could make that call. But it would be symbolizing the council members' recognition of their lives within that particular area that they are representing. Right after that, we would have a moment of silence, just literally everybody pausing again to just take a moment and breathe in what just happened, followed by closing remarks. And then we would have one of our local faith leaders again, hopefully a different person, close out the memorial service. So this is the plan that we put together with several members of staff. We certainly could modify this in any way that council feels appropriate, but ideally what we have here is trying to give you an opportunity to look at something that could be put in place, bless it as is, make modifications either today or during this meeting, whether they're to the draft wording for the plaque or any of the items on the agenda. But here's what we're presenting to council or to this committee right now for consideration.
Thank you, Mr. Brown. So I would like to open up the floor for some discussion on this some brief discussion on this matter. Ms. Mackey, you're recognized.
Thank you, Ms. Barron. Administrator Brown, thank you for your confidence in my performing abilities. I do. I did want to make one suggestion, if possible, consideration of adding some type of remarks to the program to acknowledge healthcare professionals and those who worked in hospitals. They just have been on the front lines for so long through this and still continue to help many as we look at our hospitalization. So there could be some remarks added to acknowledge the frontline workers. That would be good.
Absolutely. Ms. Barron, may I ask a question, ma'am?
Yes.
Ms. Mackey, specifically, and I heard you say added to the program. I didn't know if you had a chance to look at the draft wording of the plaque and just still thought that information should come out in remarks for the program rather than potentially just being included in remarks on the memorial plaque, which will also be read.
Correct. I think it should be
Okay.
both. I like it being on a plat, but I would like for someone to also take some time and actually speak to that during the program.
Okay.
Yes, at least some thank you for your hard work and efforts during the pandemic. You know, you want to thank those folks.
And I think that we could probably add it in to some of the opening remarks or even during council remarks. Should we decide to leave those items there, I definitely think that we can add it during that time. But it's a great point, Ms. Mackey. We can't have this tribute or this memorial without definitely thanking the individuals that helped so many. Ms. Mackey, did you have another question?
That was my only comment. Other than that, everything looks good, and I'm glad to see this proposal and us moving forward with this.
Thank you.
I'm pleased also, and I like Ms. Mackey's addition regarding the healthcare workers. And
Ms. Newton, you're recognized.
Thank you, Ms. Barron. And first, point of personal privilege, I realized as I was looking at this that I missed the line in the minutes where it says I did not vote for the COVID memorial. I remember myself voting in the affirmative. So if someone could double check that. I realized we approved the minutes, and if I need to officially move to reconsider the minutes, I'll do that. But if I don't have to, that was an error on my part. And then I don't want to get into really crazy wordsmithing, but in the draft wording on the 5th line where we talk about the emergency workers and all of the others on the front lines, pardon me, I guess I would just like us to consider, you know, are there others that we would want to add? I know we don't want to have a list of 50 people or 50 types of people who fall into the essential workers category, but I know I sure do appreciate my teachers who in some cases never left the classroom, who were there on the front lines. Again, don't want us to get into 50,000 lists, but they're those essential workers who were making sure that we had food to eat while those of us who were able to quarantine were able to do so. So I guess I would just ask that if that's language that we could look at in a way to make it just a wee bit more inclusive of the great number of people who went out every day to make our lives possible.
Ms. Newton, would changing the phrase instead of listing the individuals and just identifying essential workers, would that suffice, or should we be specific?
You know, I'm really flexible on this, and I don't think we have to wordsmith it in this format. I certainly don't want to remove the doctors, nurses, and emergency personnel whom I appreciate. I think there were a lot of people, like I said, who made our lives possible. And so if we could be just a wee bit more inclusive, that would thrill me there.
I think you can probably cover everybody with 4 or 5 different topics, you know, 4 or 5 different groups. You can probably cover most of the folks. If you just group all the educators together, you group, you know, all the persons who provide the food together, and group all the folks who provide the health care. I think you can do it in 4 or 5 groups.
Ms. Barron, if I may, I'm certainly amenable to that with Mr. Livingston's suggestion. I don't want to short shrift anybody by adding, but again, a lot of people helped.
Yeah, but I think we do, if we take the road of bigger, broader groups, I think we'll catch everybody. I do think that's great. So instead of listing the doctors and the nurses, we could just say medical professionals.
Right.
You know, so I think that we can look at some words that will cover that. Was there any other discussion about the memorial service that we're looking to plan? So with that, if there's not any further discussion, I think that our next order would be just that, Mr. Brown, let's go ahead and confirm as you've drafted here and try to finalize this so that we can have something etched in stone by our next meeting.
And Madam Chair, for the record, I'd just like to move that we, as committee, support the staff with a few things we suggested, support the staff recommendation to move forward.
Second.
Any further discussion? Ms. Mackey?
Yes, the only other thing I guess I want to confirm and make sure is that we, in addition to this kind of program, that there is some capability of recording and live streaming or that type of effort also involved. It's not listed here, but I just want to make sure that we plan to do that as well.
Very good point. Very, very
Yes,
good
ma'am.
point. So we have any further discussion with this? Because I do believe that the discussion at this point is that we're authorizing staff to finalize everything based upon the recommendations that are given today.
Yeah, that's committee's recommendation, yes.
If no further discussion, Ms. Mathis, we need to call for a vote.
McBride? Livingston?
Yes.
Joe Walker? Barron?
Yes.
Newton?
Yes.
Motion passes.
Thank you. And our next order of business is the mass ordinance / safety plan. It came up in our last meeting when we were having much discussion about what to do with our mass ordinance. I thought it would be good for the body if Mr. Brown would give us what he started, and what I found out is that he already pretty much had a reopening plan already in place. And so that was some concerns that many council members had as we move to either extend or allow our mass ordinance to expire, that the safety of the employees as well as the citizens who will come into the building. Mr. Brown, you want to provide us with that update? And for my colleagues, it starts on page 16.
Yes, ma'am. And what I put in the packet was some additional information I wanted to walk you through in communicating some of the information that will be used to modify the plan that we have, which is our quote unquote draft plan. It's really a plan, and it's been in draft mode the whole time because things keep changing with the COVID-19 pandemic. But as you was communicated in the packet during council, there was information discussed about this item, and so before the next council meeting in your regular packets, you will have what will be at that time our most up-to-date version, and a version that you could utilize to say, okay, here is specifically what Richland County intends and is doing right now in terms of how we are operating and how we expect to operate even into when we open up, quote unquote, fully for the public to come in. In your packet right now, what you have in front of you is specific to workplaces. And you see this is the guidance that is provided by OSHA. And that's important because as you see right at the beginning, the CDC issued new guidance. OSHA was reviewing that guidance to see how their workplace communication would then be impacted by that. But the categories as you go through this plan that you see in here are areas that we've used from the CDC to put the initiatives that we have in place. So for example, if you were to turn the page, begin on page 18, where it talks about the role of the employers and workers in responding to COVID-19, as you talk about safety in the workplace. It talks about right there, beginning in number 1, the assignment of a workplace coordinator who will be responsible for COVID-19 issues on the employer's behalf. So right now, whenever there's an issue where there's an employee that has an exposure, or we are notified that someone has had an exposure to COVID-19 in the workplace, that process includes notification to our risk management department, notification to our operational services team. And then what happens is, depending on whether or not there was a direct exposure or indirect exposure, there's the protocol that is determined is who needs to leave, how long they need to leave, and our operational team comes in and desanitizes the area using our electrostatic application. And so we have that coordinator in place, and that rolls out with those issues. If you go to step number, item 2, talks about identification of where and how workers might be exposed to COVID-19 at work. That's where you see that the county has gone in and put in the additional either signage, or we have put in the additional hand sanitizers. We've put in the screening tool so that before people come in to the facility, they get screened, and the various signs. So that kind of speaks to how the county deals with those potential areas of exposure. We put in the barriers. We're going to be adding more barriers, as we're going to get to here later on in this information as well. But again, these are things that we've put into our plan that communicate, here are the things that the organizations such as OSHA and the CDC are saying, here's how you make sure, or that you put in procedures that help to open safely. So doesn't necessarily mean that we won't have any incidences, but these are things that we've put in place based on the guidance from OSHA and CDC, and we're waiting on updated guidance from OSHA as well. As you go throughout each of these sections, and I can cover them each here, identification of combination of measures that will limit the spread of COVID-19 in the workplace in line with the principles of hierarchy of control, okay? Again, that goes back to when we were talking about what happens and what's Richland County doing. So some of that is the masking, some of that's the face covering, which includes face shields, face screens for folks who cannot be masked. That includes the Microban 24 spray that goes on all of the surfaces, whether that's the elevators and those high touch points that people go into on a daily basis. These are all things that are born out of our response in looking at what the CDC and the OSHA are saying we should be doing and the things that we are actually doing. I'm not going to go and all the things, but I'll just cover a few others here. Consideration of protection for workers at high risk for severe illness through supportive policies and practices. We've talked about before how I have communicated to the internal departments that we have here that we will continue to work with individuals who may be more at risk than others. That includes individual understanding of accommodations based on individual needs. Some people may continue to have some need to work remotely for a time. That's something we will consider individually. That's not a blanket approach, but that is something that is specific to folks who may have severe illness. There may be folks who, unfortunately, based on their condition, who may simply have medical information that says they do not recommend it to come back in a overall group environment. We have to take a look at that individually and determine whether or not that individual can work remotely, or whether or not there can be other accommodations made. So these are all things that are currently going on, but we have supported through our policies that individuals who have severe issues related to COVID, that it is not a blanket one size fits all. We will consider those issues independently of other personnel. So we're again complying with both the CDC and OSHA's guidance on how we deal with individuals. Again, establishment of a system for communication effectively with workers and in the language they understand. So we have our language posters. Generally, they're only in 2 languages that we have. There's generally we're posted out in English and then in Spanish. And then the educate and train workers on your COVID-19 policies and procedures using accessible formats and in the language that they understand. Our risk management department and human resources department had trainings. We will continue to have trainings about how the county has initiatives in place and how employees should utilize the forms that we have for them to use, how they request time off, how they report information to their departments, and then how their time is affected, or if their time is affected, if they have a COVID-19 experience. So all of these are things that over time have changed somewhat, but we have continued to address those with the departments. At the same time, we have opened up for limited in-person services and communicated to constituents and your citizens who are coming in, COVID-19 screening, masking protocol, social distancing efforts, the ability to still do the work online unless you just need to come into the building. But if you come into the building, we can serve you. We're just asking that you stand in line on the marked areas that say stand at your distance, and that when you go up to our stations, that those stations have plexiglass or shields so that our employees are not directly exposed to individuals, whether they are masked because they are following the guidance, or if they have a medical condition and can't be masked, there's still a barrier between those individuals and our staff members. So these are things that are in place today, not things that are going to be in place. These are things that are already in place that we're doing to help protect individuals in the buildings, as well as individuals who are our current staff members and co-workers. So again, I'm not going to go through every single line item in here, but this is what helped form the information that we utilize and put in place to affect the safety of individuals entering 2020, as well as other county facilities that we have in our general purview. So I'll stop there, Chair Barron, and then I'll open up for any questions or just any additional information that the committee might want to share at this time.
So any of my colleagues have anything that they'd like to add to Mr. Brown's presentation? Mr. Livingston, you're recognized.
Mr. Brown, how are we informing the employees in terms of guidelines, expectations, and so forth?
Yes, sir. So 2 ways. One, with information that comes out from our office about what we're doing in terms of the protocols. That's the main way. And then Human Resources has sent out a multiple number of emails. Not only that, included it in the HR Weekly. So that's generally how those employees are getting that information, besides also having access on the employee intranet.
Thank you.
I see Ms. Mackey, then Ms. Newton.
Thank you, Ms. Barron. So Mr. Brown, I guess my question is, when we look at the plan,
Ms. Mackey,
that
you're
you
breaking up a little
mentioned
bit.
having in place now and making sure that, you know, employees are safe. Okay, can you hear me now?
Yes.
No.
We can hear you now.
Is this working, Ms. Barron?
Yes. Yes.
The question was about employees and the plan that you have. Does the plan address the public coming into buildings and any rules or things that we're in place? For instance, you know, now guys about making sure that we're not letting too many folks in a building, right? Addressing the capacity limits and making sure that employees are still safe when the public comes into buildings.
Yes, ma'am. So one of the things that I'm going to do and is meet internally with, for example, the treasurer and the auditor, and so that we can have that discussion about, you know, what are we going to do in terms of capacity? So, you know, whether or not we're going to restrict a number of individuals from actually, you know, accessing the building at one given time. And then we would have to include the sheriff's department in that, because the question is going to become then who is going to enforce those restrictions. The last time we had a general conversation about this matter, there was some discussion about the desire to limit capacity, but there was no commitment on who would actually be the one to, you know, continually make sure that the capacity was only at so many numbers. So that would be a coordinated effort. But I did want to meet with the treasurer and the auditor in particular, as they have 2 offices that are mainly receive a large volume of folks when the building is open, to determine, you know, whether or not a restriction on capacity was something that they thought was necessary, or how they would recommend, what would be their input also in having those personnel come in, because mainly they have a large volume of folks that are coming into the building at any given time. So the plan currently does not say that the capacity is limited to X number of percent at this time. No, ma'am, it does not have that as a solid defined term at this point.
Madam Chair, I would like to suggest that we look at adding that to the plan, at least as a phased approach as we move to opening back up. And then also, Mr. Brown, does your plan address the continuation of monitoring COVID numbers? So if 6 months from now, are we still going to be monitoring the numbers and then making adjustments if needed, if we start to see a rise? Or if we notice in one department, there is several people who contract COVID, are we then going to reset for that department and start back over? Does your plan address those things?
Yes, ma'am. And in particular, we've already had to deal with that throughout the course of the pandemic. We hadn't had to do it so much here lately, but early on in particular, there were several times where we had to, quote unquote, reset the expectations for departments and deal with departments being out or on limited staff because of folks being exposed to COVID-19. In terms of the following numbers going forward, the recommendation that the plan is going to say is that we want to make sure that we are following CDC guidelines and reviewing those key indicators. We don't want to put in my recommendation would be not to put in hard numbers that would automatically say we, stop service or somehow modify service, because as we've seen throughout the entirety of the pandemic, I think when people put in hard numbers, they were very hard pressed to follow those guidelines because things kept changing. So certainly I would want us to model those key indicators like we're watching now, but I would want to say to follow the CDC guidelines in terms of where they say would be those thresholds would be my recommendation that I would hope that would be supported, Ms. Mackey.
All right, Ms. Barron, 2 more questions, then I'm gonna let somebody else go. One was, will we continue to provide any PPE to staff while they're working if needed? And then 2, will we still offer all of the online sales back up?
So the first answer is yes, ma'am. We believe we have purchased and will continue as necessary a combination of cloth mask, shields, both vertical, meaning that from the face down and from the neck up for individuals who cannot necessarily wear a mask, but want some type of face shield that staff can have access to. And for those responders who are like in the detention center and the EMS fields, they have all acquired a PPE for their departments as well. So yes, ma'am, we will continue to provide PPE for any staff that has need of that. And in terms of the second question you asked about, can you clarify that for me? I talked a little bit too long there. Can you tell me what the second question is again, please?
Yes. Will we continue to provide all of the online services that we currently offer, even when we open back up?
Yes, ma'am. My understanding, I have not received any requests to stop there. As a matter of fact, what we're trying to do is to figure out, how can we make those services online more accessible, not how can we eliminate them. So we recognize that there's a population of Richland County that online services work just fine, but there's also a population where it does not and they require in-person services. So we want to balance out and serve both of those agencies within Richland County. So yes, ma'am, we will continue to offer online services.
Ms. Mackey, you finished?
Yep, those are my last 2. I'm let somebody else have a turn. Thank you.
Okay, and so we have Ms. Newton, then Barron.
Thank you, Madam Chair. Mr. Brown, a few quick questions. 2 of them are tactical. One of them is a higher level. Just for my information, did we do anything to improve ventilation at 2020 Hampton Street?
My understanding is not, I do have Randy Pruitt on the line. Did not add any new systems, but my understanding is that we do have HEPA filters in 2020 as a part of our circulation. So Director Pruitt, if you're on the line and can clarify that or correct information that's not correct for me, I'd appreciate it in terms of ventilation quality for 2020, if there were any additions made and kind of where we currently stand with our ventilation.
Madam Chair, may I be recognized?
Yes, Mr. Pruitt.
Yes, we do have the HEPA filters. We have tested our system. We have not detected any type of virus transference through our systems. So we should be adequately prepared.
Thank you. And then my next questions are, Mr. Brown, did I hear correctly that you're going to submit your reopening plan in the packet for next week's council meeting?
That's correct.
So understanding that it's a draft, my request would be, can I just see the draft? And I'll understand that it changes, but
Sure.
I'm going to want to sit with that a little longer than getting it on Friday afternoon. So I would rather see that if I could.
Yes,
And
ma'am.
then regarding it being in our packet, it's going to be in our packet for review, in our packet for approval. What is there going to be action attached to that?
Yes, ma'am. I'm not sure whether or not council wants to weigh in and provide specific action. I'm certainly welcome to hear that. And the reason why I say it that way is because throughout this time we've been operating. So I'm not sure whether you just want to be informed and understand, or whether or not you want to add some specific things to it, like Ms. Mackey just did, and asking about capacity. And I'm fine with either way.
Sure.
So, Ms. Newton, I don't have a better answer for you, but it will be provided for council's input. And certainly we'll take any recommendations you feel would be better, helpful to keep the safety of the citizens and employees first and foremost.
Perfect. And I was just curious. So you have answered my questions. Thank you, Mr. Brown. And thank you, Madam Chair.
Mr. Brown, I do have, I'm going to start with my question and then I have maybe a suggestion.
Okay.
And so my question is that will we continue appointments even when we open fully? When we open fully, will we go back to business as usual, where if I'm just in the local area and I got to pay my taxes, I can just drop in there? Or will we still have to have appointments in order to conduct business?
No, ma'am, my expectations when I say that the county, admin building is open, full openness, the ideal would be that it does not require an appointment. There may be departments and there may be citizens who have enjoyed, having an appointment. So I don't think that departments, where that's a benefit, need to take that away, much like the online services, but they'll not restrict individuals from just dropping in because they want to walk into the county building rather than use online services.
Okay, very well. And then, so as a suggestion, I had the opportunity this weekend, my church opened for in-person services on yesterday. And one of the things that I thought was extremely helpful was if you had a child that was going to children's church, they showed you a video of exactly what to expect when you arrived. And so they walked us through from coming in the parking lot all the way to picking up your child. And this may be something that we may want to consider as we move forward and making sure that the citizens feel comfortable with returning back to 2020 Hampton Street. Hey, this is what you can expect when you come. These are our expectations, whether we're going to, keep the 6 feet or if we're going to keep the 3 feet, because that's now changing, those types of things, introducing them to the sanitation stations and, all those types of ideas that could be helpful, because while I see the grand reopening as probably as a party, there's some people that are, just been banging down the door ready to get in. And so I think we want to make it a seamless process for them. That was just a suggestion. something I experienced that I thought was, and I know it helped me in the ease of transitioning back to church.
Absolutely a good suggestion. We actually have, which we need to change at this point. I think we can do a better job now that there's some new guidance, but we actually have a video just like that. We did it quite some time ago. And at the time it was to communicate to employees, and then we were going to have it for citizens to show how we have put in protocols so that individuals could feel as safe as possible in coming into the facility. This was actually early on when there were still questions about should you be going into the workplace and all of that. So we actually have a video that we created that actually does that both on the 2020 side and on the 2000 side. But we will go back, and I think with some new information that we have now, and try to polish that up and make it a better version of itself. But certainly,
Absolutely,
I can probably show
absolutely.
the platform what it looks like. But yes, ma'am. Thank you.
And just as another tidbit, you know, let's just don't make the video. Let's push it out. Let's push it out and make sure everybody knows about it. If there isn't anything else for our safety plan for Mr. Brown, anything further on this item?
Not for me.
Good.
Okay, so let's move on to the item. The next item is in-person council meetings, and that's located on page 28. And we came before this committee last meeting and brought forth this creative, great idea about, you know, touring the county. While I still think it's a great idea, given lots of guidance that is coming from CDC and some feedback from either my colleagues or community members, what I'd like to propose to us, and this is an item that I would like for us to also be able to make a recommendation to council on, is that as Mr. Brown and administration is planning to open fully to the citizens of Richland County, I would like to propose on July the 1st, I would like to propose that council would go back into chambers the first meeting after January the 1st, which will be July the 13th. You'll see in the packet several things that we have put forth, and Mr. Brown and his team have made recommendations on. I will allow him to further expound on those items, but I did want to share that even I didn't see it on the list, but we've even discussed perhaps putting the shields, temporary shields on the dais and in the box form so that you have something in front of you and to the sides of you. We've also discussed those items as well. But we know that if I am of the opinion, if the county buildings are opening fully, then council should definitely go back into the building and conduct business. So Mr. Livingston, you want to speak before Mr. Brown?
No, I can wait now.
Okay, so Mr. Brown, if you'll just go over your recommendations.
Yes, ma'am. So impact on your page 28 of your packet, we'll just start right at the top. The date of the first in-person council meeting, Tuesday, July 13th. I put a message in there that CDC guidelines will be followed, and just ask that we understand that if we get guidelines that, you know, that change while we're already set up for the meeting, like on the 12th or something, that we just understand that we'll make any modifications that's necessary. But if it requires more stringent work and the guidance just changed, that we'll need some grace on that. But with that being said, we would say that masks or face coverings are required in council chambers. And the reason why we said that was because we wanted to consider the CDC factors. And as the CDC guidance currently stands, they still say take these into account when you're meeting in enclosed spaces. So the number of attendees, the physical or social distancing that can be done within that space, the length of time for the meeting, as well, that knowing that we're going to have a mixture of potentially vaccinated and unvaccinated persons. So with that being the case, that you would still want individuals coming into the chambers, since you would be in an enclosed space for a period of time and relatively short distance, with some sort of face covering. Again, it could be a face shield, could be a face mask, but just some sort of covering. We'll talk about the details of the council here in just a minute. But all attendees are still required to complete temperature screening checks, just using the kiosk that we have. All attendees who are not members of the same household or work group are asked to sit in an audience gallery and distance themselves from others. So if people are family members or they work together on a day-to-day basis, then it certainly makes sense for them to be near each other. But if folks are not of the same household or work group, then we would want them to maintain some level of distance so that we could be safe, even though we're in an enclosed space. All surfaces will be sanitized before the council meets with a cleaning and disinfecting product that is designed to protect for 24 hours after application. And to Ms. Barron's point, protective temporary shields will be placed on the council dais, presenter podiums, and staff work tables within the chambers. This will allow council members, as well as presenters, and then those staff sitting at the tables to have as Ms. Barron, that box shielding, so that you don't have to have, you could have on a face mask if you chose to, or an additional face covering, but you would have screening on all sides of you. So that way you would have a face covering without having on an additional mask or a face shield. And then as you see, it says provides a face covering for individuals who are speaking frequently. We're going to also keep hand sanitizer available in the chambers at those stations. And then after all the meetings have been concluded in council chambers, the chambers will be deep cleaned using our electrostatic treatment application, which we have the ability to do through our operational services. So again, CDC guidelines considered, mitigation protocols followed, but still able to potentially have these in-person meetings and have members sit protected in terms of their coverings on the side and in front of them from people who are speaking to them, whether they're presenters or staff sitting at the work tables. So with that being said, Ms. Barron, I'll conclude right there.
Mr. Livingston, you're recognized.
Is the 13th that's our first meeting in July, correct? I don't
Yes,
have my
sir.
budget calendar with me, but isn't that our first meeting in July?
It is, yes.
Ms. Brown, you don't recall, we don't have any committees. I mean, you don't have anything else before that, do we? Have the full council?
I'll take a look. And the clerk might be able to tell us a lot quicker than I could.
I don't have my budget count, but I don't think so. I just wanted to make sure. That's the first full meeting of council since that's the 13th. Mr. Brown, now you did say as far as for council members, you have the shields. Will council members need to wear masks with the shields?
Council
the
members,
CDC guideline requires to do that? No?
the CDC guidelines would not require that you have a mask, but they will, but it will still suggest that if you're in unvaccinated territory, that you are covered. So you will have the 3 prongs, 2 on each side of you between council members, and then in front of you, so that if droplets are coming out of your mouth, then they're going, down, and they're not going to the audience, nor they're going to the sides to council members. They'll be blocked by your desk and the screens on both sides, and then also the one in front of you. So you would still be able to wear a mask if you felt comfortable in wearing one, but you would have covering for that area.
But you would not have to, based on CDC guidelines, yeah.
Anything
That's all I have for
further?
now, Madam Chair.
Ms. Mathis, were you able to find the schedule for the week of July 13th?
Yeah, so it looks like we've got a Rules and Appointments Committee, and then we've got Economic Development Committee, and then the specially called council meeting. So they are back.
My main question was making sure we didn't have anything at all before the 13th. Is there any council meeting at all, anytime? I don't think so. Just
I
to
don't
make
believe
sure.
so. No, sir.
No,
I'm not
I don't
seeing
think there is
anything
any
on the
the
calendar.
first
Yeah.
week. The first week in July, no, sir. Ms. Newton, you're recognized.
Thank you, Madam Chair. And I'm looking to make sure that I haven't missed it. One of the questions that I would have is what we can do or what we can think of to plan in terms of capacity for the council chambers. And so the reason I word it that way is because I understand that we're letting family members sit together. It wouldn't make sense to separate a husband and wife that are part of one household, but that we just think through, and maybe it won't happen, but what happens in the event that there are a lot of people who want to come, what do we do about monitoring capacity? So if that's here, I might be missing it, but just want to make sure that that's something that we think through as well.
Yes, ma'am, Ms. Newton. It's not here. This is one of those areas where when Ms. Barron and I talked about this, that we had two thoughts, and Ms. Barron, please correct me if I get off key here. One was we were looking at how we could provide more space for citizens to come into the chambers. And what we mean by that is a lot of times, if you all notice, I've always required staff to attend council meetings. And that was because there were many times where I was hearing questions being asked and a staff member may not have been present, and then council felt like they were not being served. So I started having all council or staff members who weren't already attending, who were department directors and had items on the agenda in particular, but even if they didn't, to attend council meetings. So we're looking to see how we could open up that space by either having staff somehow either continue to be remote from council chambers, but be able to respond when needed. And so that will potentially open up capacity. But we did not determine to what extent any other limitations would be placed on the number of folks within the council chamber. So I would be looking for at least some level of guidance on, do you want that number to be a 50% number? We need to tell you how many seats you can get in there first, and then you decide whether or not you want 50% or 75% or something of that nature. CDC guidance doesn't say anything about, at this point in time, percentage of personnel in the enclosed space.
Thank you. Well, from my perspective, either way, it would be helpful to understand what that physical capacity is. And again, I know that it'll vary because if you have 10 households or 20, that looks a little different, and that's a big house, I get it, but that makes the capacity shake out a little differently. But just to keep that in mind, if we are asking everybody to socially distance, that can create circumstances where you do have to limit. And then I can get this answer offline, but I would presume that when we're back in council chambers, that we would go back to our regular live streaming service, which I think was someplace that was accessible on the county website, but I don't think it was streamed on YouTube. If I could just get clarity on how we would be sharing those, continue to share our meetings with persons who did not attend physically, that would be great as well.
Yes, ma'am.
Thank you.
Ms. Becky, and then Mr. Livingston.
Thank you. I guess, can I get clarity on how we plan to handle committee meetings? And when are we saying those would start in person or proposing to start in person?
Well, the proposal is in person for all of our meetings. That here within lies the challenge when we talk about sanitizing in between meetings and things of that nature. And this definitely is out of my scope. And so I'll toss it to Mr. Brown, who might toss it to Mr. Pruitt. But that is, the whole premise behind this action is that when we go back on the week of July the 13th, that all of our meetings would be in person from this point on. Mr. Brown, could you comment a little bit on the sanitizing between meetings and things like that?
Yes, ma'am. I can comment on that. And then like you said, I certainly could have Randy Pruitt add in, but I do know that we utilize, like I said, the product, and it is designed literally that once you apply the application, that you don't have to go in and do it repeatedly under a 24-hour span. So ideally, when the committee members go into chambers, and the chambers will be pre-treated before you get in there, that certainly we can have some wipes, some sanitization wipes still in there for you if you would like to continue to have that at your disposal. But it would not require that you walk in or that you leave out and go out of, ad hoc committee 1. We come back in, we spray down, wipe down, then you go back in, and then we do that again for committee 2. The product that we use does not require that. So we feel confident that you won't necessarily have to be disrupted over and over again because you don't have protection in terms of disinfected surfaces or sanitized surfaces. So I can certainly have Mr. Pruitt speak to that more specifically, but the product that we use on all these high touch points are designed for that purpose, so that you don't have to reapply them that frequently. We do it every day,
And
we don't do it between meetings.
And as far as attendees, are we saying that they leave and then come back in between? What is the, I guess, policy that we're proposing for attendees between committee meetings?
So if the only folks that would leave and come back, and I should say, I'm saying we, but the team, they actually use the product on those surfaces. I don't know if you recall when we did that during some of the events that we had early on. So you don't have to have folks leave out, then we wipe down seats, and then folks come back in. Again, folks that want to stay can stay, folks that want to leave can leave. We can also, again, have additional sanitizing wipes in there for folks who just feel more comfortable while wiping down that area that they're getting ready to sit in. Again, but the product that we use does not require the application to be done after every seating. It's a high touch point product.
Madam Chair, I see Mr. Livingston's in line. I just wanted to ask a quick follow-up question to what Mr. Brown just said, if that's okay.
Sure.
So thank you for answering Ms. Mackey's question. I guess my follow-up question would be, most of our committee meetings are not held in council chambers. In fact, the only committee meeting that I'm aware of, going back in time in my memory, is the Transportation Ad Hoc Committee. All the other committees met someplace else. And again, to Ms. Mackey's point, the Rules and Appointments Committee actually brings in external candidates to interview. So we don't necessarily have to dig into that right now, but that would be my question, how we handle those committee meetings that are elsewhere.
We could do the same for that room. So knowing that we had a meeting for the, in this instance, Rules and Appointments Committee in the big admin conference room, we could have the same application applied to those surfaces and do it that way. That's the quick answer, but certainly if there were other things that you want to consider, we could do that. I'm not sure if your thoughts are, should we also try to get some temporary shielding that could be placed, around those areas that we could just pick up and take down between meetings. If that's kind of what the thought is, we certainly can move those tables around and do that. We would just need to communicate, which I can do that easily with Mr. Pruitt, and order those extra shields, and we can figure that out. But we could do that. The only thing I would have to ask then, Ms. Newton, for example, is we probably would need to know in advance how many additional council members might attend a meeting that were not a part of that committee, so that we can appropriately set that up in advance. That's the only thing I could think that would be a little bit operationally challenging for committee meetings that are not held in the chambers.
Thank you. And I just wanted to raise that point, and I'm certainly open to recommendations. I didn't want to dictate any particular course. Thank you, Ms. Barron, and thank you, Mr. Livingston, for letting me hop in there.
Mr. Livingston, you recognize.
Mr. Brown, one thing I'm not clear on how we're going to handle is just regular meetings, executive sessions. In the past, we've gone back into the small conference room. And there were times now when we didn't go back there and we stayed out front, but then that meant whoever was in the chamber had to leave the chamber. So that may be a little bit problematic, trying to figure out what's going to be the best way for us to handle full council meetings, executive sessions. Now, only the answer, I'm just saying it's something that we got to figure out.
Yes, sir, Mr. Livingston. I've been thinking about that. So, and the reason why I was shaking my head is because when I was thinking about the executive sessions, I thought about, okay, if I have staff members who are not in council chambers because we're giving more space for the community, and so those members are, you know, upstairs in the fourth floor conference room. Well, then if council has to go into executive session, then, you know, do they go to the fourth floor conference room so they can spread out and do, put staff somewhere else? So you're right, Mr. Livingston. These are some things that I've been thinking through and haven't come up with a solution just yet. So yes, that's something that we're certainly going to have to give some more thought to and ultimately have council agree on how they would like to proceed, whether they want folks to leave the chambers, whether they want to excuse themselves to, you know, upstairs in the building on the fourth floor to spread themselves out. So that's certainly an item that's not decided at this point, sir.
Thank you. I'll be thinking about it too.
Thank you.
Any further discussion on this matter? So while I think it may be premature for us to move forward with any recommendations or any actions, just given the amount of conversation that we've had, but I would like to encourage Mr. Brown and his team to put this in the forefront of your planning as a part of the reopening plan so that we can get this before council. And, you know, I guess this would, if appropriate, Mr. Livingston being the chair, this would need, does this need, if it goes before the body of council for us to take this recommendation to go back, does it need 3 readings? How does that work?
No, it wouldn't need 3 readings. No, just need 1 vote.
Okay, very well. So I would like for us to be able to move forward with this and get it on the agenda sooner than later. So with our next order of business is the ERAP update, which is our rental assistance program. And that can be found in your packets on page 29 and 30. Mr. Brown, you want to give us an update?
Yes,
and you
ma'am.
can just give us the high points.
High points here is you can see as of the 21st, $2,265,000 is what we had approved for ERAP program. So that's how much money that has gone out and been approved for folks in that program. We're still on target to meet our projections that we presented to the council last week. So that has not slowed down based on these last round of approvals. On page 30, again, you just have a breakdown in there by zip code of the applications and those approved by zip code, as well as the related levels of need associated with AMI. So all that information is in there. It's just the updated information as of the time of this presentation. So Ms. Barron, that's all I have for the ERAP update.
And I want to just bring to the committee's attention that Mr. Brown and I have had lots of conversation around community engagement, and we're going to continue to push forward with some creative ways to get this information out to the community. I know last week there was a faith-based meeting. We did have a couple of community members to join us. However, I would have liked to have seen a greater impact there. And so just to knock it out of the park, again, I'm hoping that the staff will revisit that item to look at how we can really engage the faith-based community. because I think that we could have done better. I'd like to see us do better with that, because they are a critical piece, a part of getting information out to our community. So our last order here is Mr. Brown's going to give us an update on the COVID relief funding, somewhat of an expense plan. But what I've asked him to do is we're starting to get more guidance on what these funds can and cannot be used for. And so that's the part that I would love for Mr. Brown to spend time just giving us the update on how we can expend these funds. And then if there's any other feedback from my colleagues that you may have some questions in reference to that. Ms. English, I see your hand. Is there something that you want to address prior to Mr. Brown talking about the relief funding?
Yes, going back to what you were saying about faith-based, when I spoke to several of the associations, many of them have foundations as well, so that you are not giving to a ministry, but a foundation that is already set up. It's been in place and they've been servicing the community for years. So I just wanted to share that with you with the committee, as you go about making those recommendations and just considering all those things that are in place. So thank you, ma'am.
Thank you, Ms. English. Mr. Brown and I did have that conversation. And so now it just becomes, if we are allowed to do those types of creative initiatives with the funds that have been awarded. So that's what we're looking at this point. So Mr. Brown, toss it back to you for the relief funding.
Yes, ma'am. And so I don't want to, read what's in your packet, but I do want to just take a moment and talk about what's happened over the last couple of weeks. And I do have on the line both Lori Thomas and Mike King, and there's several others who've been following along with this. So NACO, the National Association of Counties, they put out some information on the American Rescue Plan. In your packet was one of the trainings, webinars, informationals that staff participated in. Also, the Government Finance Officers Association of the United States and Canada also put out some guidance, but they were having their first and second meeting wrapping up on last week. So there's some additional information that we're going to provide to council that comes from GFOA associated with the American Rescue Plan. But what you have in your packet right now from NACO gives you a high-level overview of some of the categories in which, as you go through the American Rescue Plan, that you can see funding in general, it can be eligible for. So right now, there is multiple programs potentially that you can use. There is not specific guidance from the Treasury. So again, just like we did before, we want to get that information, but there's some interim information, and that information can be found in your packet. So right off the bat, if you look on page 35, it talks about common questions on recovery funds. And it gets into how can counties use recovery funds. And it starts giving you some general information to help you understand some of the questions that counties have been asking to be addressed. So in your NACO packet, again, high level information, but it gives you some general overviews. So if you flip over to page 41, you will see there, it talks to you about some of the public health response that you could utilize funding for. And again, it goes through different categories and breaks it down kind of generally about these different areas. So these are in your packet, different opportunities that we may potentially consider. There's quite a few, as you would imagine, depending on how many we choose to do, whether they're listed here or other ones that we come up with from the county's perspective. It will require a lot of manpower in terms of staff, in terms of the services and the way we get this done, whether it's a combination of collaboration efforts. Just depends on how much we do, Ms. Barron, quite frankly, as it's going to focus on, how many different directions we're going to go in. So what we look to do coming up here very soon is to get some additional information and then provide council with some opportunities from, let's just say, from administration standpoint. Not necessarily saying, you know, here's our only recommendations, or we're only asking you to do these things, but here are some things that we believe are some key things that we really want you to consider. A couple of those I've expressed to include stipends for various essential workers who worked throughout the entirety of the pandemic, who are dealing with the public or dealing with COVID-19 exposure on a consistent basis. So that would be one of the ones where I'm going to be asking the committee to put forth as one of those areas. And we're going to continue to look and find out what items and what services we can utilize that are considered. There is a breakdown on certain things that we can do. For example, we may not be able to acquire certain equipment because there are limitations on certain things. So, but we'll have to dig into all that, and I'll share that with you. So some of my recommendations may come to you and may say, I would recommend these things. However, based on how we can use the funds, that's why I'm not recommending these things, because we've learned that those are not eligible for consideration. So those are some of the things that we have not all gone through as a staff level yet. But I expect that now that we have guidance from NACO, from GFOA, that we'll continue to dig through and be able to come back here relatively quickly within the next few weeks, that we can provide council some general information on areas where we think we can focus on, and then take information from council as well. This will be one of those areas where I do think I'm going to be asking council for input rather than it just be a situation where I come to council, make recommendations on the way to spend the money, which may not be consistent with some of the other thoughts that you all may have on areas of focus. So I would like for that particular area to be a collaborative effort. So I'll stop there, Ms. Barron.
Thank you, Mr. Brown. I see Miss Newton, then Mr. Livingston.
Thank you, Madam Chair. Mr. Brown, I'm sure you're surprised to know that I have a question. Two quick ones. One is, can you remind me of the amount of funding for Richland County?
I can. So the amount is roughly $80 million. You would get that in what they're calling 2 tranches. One would be the Treasury will release to us. So you get half of that. And then within the next 12 months, I believe after that, you'll get the second half, which will be, roughly $40 million.
Thank you. And then my next question, to the extent that you know, is, are there deadlines that are currently made available to us in terms of when this funding needs to be expended? And I guess as a corollary to that, given that in some cases, these aren't funds that we have now, are we being encouraged or discouraged from spending some of those funds in advance of the allocation, or are we being told you better wait until it's sitting in your bank account?
Okay, so let me answer the first question on the dates. So if you look on page 36 of your handout, and if you don't have it with you, that's no problem. But recovery funds must be obligated, not incurred, by December 31st, 2024. Okay, recovery funds must be spent and all work performance must be completed by December 31st, 2026. So money obligated by December 31st, 2024, all spent by December 31st, 2026. And that should be located on page 36 of the current packet in NACO's handout. In terms of the second question about whether or not you can spend funds now or whether or not you're being encouraged to wait, I guess, Ms. Newton, I guess it depends on who you're asking that question. If you're asking me, then I'm asking that you get the money in hand and then you go from there. But I think that there are agencies out there who are anticipating funding, who have determined that they're going to spend what they're going to spend and just kind of wait for money to come in. So I don't think there's a one way or the other. And I haven't seen anything that from guidance that says you should not spend it until you receive it.
Thank you, Mr. Brown. Thank you, Madam Chair.
Mr. Livingston.
Ms. Brown, you answered my first question. I wanted to quickly verify that the direct appropriations to the county was 80 million. So you did mention that. Mr. Brown, there are also some, state funds for broadband and other kind of things. What are we doing to make sure we get some of those funds that the state has regarding to the recovery?
Yes, sir. So one of the things is we want to be informed about that. And I know that we've had at least one provider ask whether or not that funding was available as of yet. And I know there's been at least one conversation that's been brought to my attention by member of the Senate concerning available funding coming down the pipe. So, Mr. Livingston, what we're trying to do is being aware that the money is available so that then we can go after it. So that's one of the things that we're doing to do that. And then the other thing is we are planning to bring back to council, going back out and see if we cannot get someone that is on the county's payroll to act in the lobby mode on behalf of Richland County.
Yes, we certainly, right now there are other counties lining up, talking to senators and council members and other elected officials, legislators to try and get the state appropriation. So we really got to step it up and make sure we get someone at the State House screaming on our behalf before the funds get lost. Also, I understand that the federal government is having, not only is that direct appropriations available, but there are earmarks at the federal level regarding COVID. And I know, I think the House already made some appropriations, but the Senate is still working on some. So we need to figure out, how we can get some of those federal earmarks as relates to recovery funds too.
Okay. I'm gonna take a look into that, Mr. Livingston. I wasn't familiar with that, sir.
Thank
you. Mr. Livingston, you're finished?
Yeah, you might want to follow up with Dalton Tresvan at Clyburn's office, because I know he was working with some counties, and it may be too late, but I know it's not too late for the Senate though. Thank you, Ms. Bear.
So with that, I've got a couple of questions, Mr. Brown. There was some talk, and I don't know it to be gospel, that checks have been already dispersed to counties. Are you aware?
Yes, ma'am. I think I got a message while we were sitting here, and it looks like as of Friday, that the county did receive an allocation of 40 million. Lori Thomas, ACA County Administrator, Ms. Barron, can you recognize her to confirm that?
Absolutely. Ms. Thomas, you're recognized.
Thank you, Ms. Barron. Yes, ma'am, we did receive $40,375,000 roughly on Friday. We will not receive the second allocation it won't be less than 12 months. So it would be sometime this time next year or slightly thereafter. But yes, ma'am, we have received the first allocation of funding.
Okay, so with that being said, it kind of does expedite things, and it's kind of what I was hoping to do is that when the money came, that we would have some type of plan in place or a priority wish list, if you allow me to say, so that we can start to move forward with it. And I know you and I, Mr. Brown, have had conversation, and we will follow up next week about moving forward with our essential workers stipend, or I'm not sure what we're going to call it. But we will start to look at that so that we can get those funds in the hands of the people who have been taking care of us during this critical time. But now that we know that we have the money, I think we need to, definitely start to move forward with putting some things in place. One thing that what popped out at me when I read the plan was roads. I think our penny tax, I received a call over the weekend that the penny tax, there was some, I guess they had to cut off some programs or projects because of just didn't have enough funds. So I don't know if we can supplement even some of those projects to ensure that we can get more done in that area. Just throwing out some ideas here, because I don't want us to be reactionary at all, and definitely looking at the opportunity that Mr. Livingston brought forth. I think we can we're able to supplement a lot of things that we've missed out over these COVID days with the funds that are coming down.
Ms. Barron, if I may, one other comment.
Sure, Ms. Thomas.
You had asked earlier if there is any restriction on spending, and while there is not, I would let you know that it took Treasury roughly 2 months to come out with what they call interim final guidance, which is an oxymoron in itself. They are taking questions and remarks to get final guidance for the next 60 days, which would be that the last day is July the 9th. They have committed to come out with final guidance on July the 16th. So during this time, things are becoming a little more firm. I think the employee emergency pay, or employee pay or stipend or whatever that is, that's relatively solid. But there are still lots of other areas within the guidance that are not quite as structured and not quite as clear as to uses. So as we get that information, we'll be passing that to as well, so that you'll know what is relatively firm and what is not as firm within their regulations.
And thank you for clarifying that, Ms. Thomas. But to my point still, we can hope and wish and dream in the interim and create our wish list. And I'd rather us have a list and have to mark off things that we can't do, than waiting to July for final guidance to come down to make a decision on, to what we're going to do. Ms. Newton.
Thank you, Ms. Barron, for that perfect segue. I've had conversations with the administrator, and I just felt I would be remiss if I did not mention that I would love for us to give serious exploration under infrastructure to what we can do from a sewer infrastructure perspective. My very first presentation at Richland County at Retreat was talking about all of the maintenance, all of the things that were needed there. On the NACO spreadsheet you've given us, it's listed as one of the areas that requires more guidance, but this will not be the last time that you hear me ask about it. So allow me to go on record so I can prove myself consistent advocating for anything we can do for sewer infrastructure, particularly with an eye for things that will bring down those rates for our citizens. So thank you for that point of personal privilege, and also for the ones to come, Ms. Barron. I appreciate it.
You're absolutely welcome. So Mr. Brown, Ms. Thomas, you've heard an item to go on the wish list. So is there any further discussion?
Yeah, one quick question is, I'd like for Mr. Brown, as soon as he can, at least to start giving us some preliminary recommendations in terms of what he see as some essential things we need to consider with those funds, and if possible, if you have any ideas next week or whenever, and so we can quickly have a meeting so we can at least use that meeting to make some recommendations to full council, so we can move forward on some things if possible.
Yes, you're all in my head, sir. You're in my head. Ms. Newton.
That was an old hand, but I'll say
an old hand.
Sewer. Thank you.
No, you take advantage and treat that, huh?
So, but thank you, Mr. Chair, for bringing that point, because that was how I was planning to really tie a bow into this discussion is that I do anticipate sending out a correspondence to the committee within the next 24 hours to pin another meeting time. The great thing about an ad hoc committee meeting is that we can meet at the will of the committee. And I think that
as needed.
As needed. So we definitely have some hot topics that we need to talk about and to keep the ball moving to continue to assist Mr. Brown and his team in what's needed. Any further discussion about this item? Before we adjourn, I did want to acknowledge that we had some of our colleagues join us earlier, and I failed to mention them, but I saw Ms. Teratio and Mr. Pugh and Ms. English joined us today. So thank you for joining this meeting. And and Ms. Mackey, anything further, the last order of business is adjournment.
So move, Madam Chair.
Second?
Ms. Mathis, if you'll call the roll, please.
Certainly. McBride? Livingston?
Yes.
Joe Walker? Barron?
Yes.
Newton?
Yes.
Motion passes.
If
Thank
nothing
you.
further, thank you so much for joining us. And until next time, y'all have a great day.
Now I can spend my next 2 hours doing my real job work while I'm in my office.
Get ready
Get
for your
to it, sir.
singing engagement.
You can do some of mine too, Mr. Livingston.